Our advice has been, I think, quite consistent in advising countries, number one, to open up slowly in a stepwise fashion, to wait between different phases of reopening, to ensure that the data on the virus is clean and clear and tells you where your problems are, to be ready to move backwards or forwards depending on what that data is telling you, and to accept the fact that in our current situation, it is very unlikely that we can eradicate or eliminate this virus. There are very particular environments in which that can occur, island states and other places, but even they risk re-importation, and we've seen countries who've managed to get to zero or almost zero re-import virus from outside. So there's always a risk, either from within or from bringing disease back in. And therefore, it is a given that there is always a risk of further cases. The transmission that occurs in that situation can be single sporadic cases, which can be relatively easily isolated and quarantined. A more worrying pattern is large clusters of cases that could occur in association with super-spreading events, events in which there are large crowds gather, the virus is present, and you get a small explosion of cases, which can very quickly mushroom into a much larger case. It's very analogous to a forest fire. A small fire is hard to see, but it's easy to put out. A large fire is hard to see, or easy to see, but very difficult to put out. So you really need a system where you can detect the small flames, the small embers that may be there. You can detect a small fire and put that out by good surveillance, by good detection, by aggressive testing, and then by isolating cases, quarantining cases. Throughout all of this, and I think this is probably a very central message, that when the virus is present, there is a risk of spread. The authorities can have surveillance in place. The authorities need to have that in place, isolation, quarantine, all of those other measures and testing. But ultimately, it comes down to communities and individuals and how we protect ourselves and how we protect others. When the virus is in your community, it is quite clear that there are things you and your community can do to reduce the risk of those infections. And it's very important that people feel empowered, that they have the knowledge to be able to do that. So it requires a very strong partnership, a trusting partnership between communities and authorities, a trusting partnership based on honesty, based on transparency, based on regular information that everybody can trust, and based on a sustained effort by everybody. It is very tough right now. It is very tough for everyone to maintain the kind of vigilance that people are being asked to maintain. It is tough. It's not easy. But we have to be able to sustain that. So if we want to avoid, after lockdown, having major epidemics, we need to watch out for the small clusters, and we need to extinguish those clusters quickly. We all need to remain vigilant. We need to remain vigilant with our physical distancing, with our hygiene, with mask wearing in the appropriate settings. In that situation, we can potentially avoid the worst of having second peaks and having to have to move backwards in terms of lockdown. It is also, and you've seen this in a number of countries, are managing to deal with clusters and with flare-ups by having limited geographic lockdowns, locking down small areas in order to contain the disease. And I think it is a matter of scale. Countries can and should be able to contain the disease through those measures. We all want to avoid whole countries going back into total lockdown. That is not a desire that anybody has. But there may be situations in which that is the only option. But this is a fundamental question right now for everyone, for every community, for every society. It is going to require sustained effort. It's going to require a lot of trust. It's going to require clear messaging. It's going to require a huge investment in sustained public health effort and a massive investment in community empowerment and the capacity of us as individuals and our communities to act and to stay safe. Maria, you may want to add.
Thank you, Mike. Yes, so I mean, as Mike has said, I think this is something we all need to anticipate, that there's the possibility that there could be a resurgence, there could be these small outbreaks. But I think what we have been advising is in these situations is to act fast and to act comprehensively. Use the public health infrastructure that you have in place. Many countries have worked incredibly hard to improve the infrastructure that's in place to be able to find cases, test cases, isolate cases very quickly. and if they have symptoms, if they develop disease, to ensure that they are cared for appropriately in the appropriate facilities. To put contact tracing to the test, carry out contact tracing as comprehensively as possible, quarantine the contacts so that you break those chains of transmission, and inform the communities often, regularly, honestly, thoroughly, because the situation is evolving and we know how quickly these embers can really turn into these forest fires. And with that hope that if restrictions need to be put in place, they're put in place temporarily. They're put in place in a limited geographic region only to help, and that they're not put in place for long periods of time. But it is possible that these small outbreaks, that these small clusters can be prevented into being turned into large outbreaks. We've seen this time and time again. So it is possible. And as Mike has said, and as we have said, be part of the response. Everyone has a role to play. If you're asked to stay home, and you can stay home, please do. If you're feeling unwell, stay home. Call your healthcare provider to find out, call the hotline, find out the next steps that you need to take. Because everybody needs to play a part in this. And it will take some time while we figure out how to get through this together. But it is to be expected, but we have tools in place. And governments have worked incredibly hard. Communities have worked very hard. Individuals have worked very hard. We just need to put those tools in use again.